Healthcare, at its most basic, healthcare is about taking care of those among us in their time of need. That is what healthcare is. That is what healthcare does.
My main concern regarding the state of healthcare is diminished access for underserved populations. The Healthcare Reform Act as it stands was an incredible way to get more people engaged in their healthcare and to provide access to critical services like behavioral health and substance use disorder services. With changes to that, we risk losing access not only to primary care, prevention, but also behavioral health and substance use disorder services.
And making the resources available at the federal level, we need to do much more. Healthcare is a right and not a privilege.
The ACA currently means that more people are covered and that coverage includes substance abuse treatment. Even now, only 10% of those who need treatment for substance abuse disorder receive it. 90% already can't get help. But that means we need more, not less, help.
DMIC patients really need to make sure that they understand what potential changes to the Healthcare Reform Act are coming down the pike and how we as a community can advocate for enhanced access to healthcare rather than reduced access to healthcare. We need to understand who our legislators are, what their stance is on healthcare reform, and how we can advocate for ourselves as a community. We also need to understand the particulars around healthcare coverage, whether or not behavioral health services are still covered by changes in the Healthcare Reform Act, whether or not there will be diminished access to substance use disorder services. All of the particulars are what our DMIC patients need to be able to understand in order to advocate for themselves.
Technology and healthcare and finance and education, and you put it all together, and in this day and age, in this kind of global economy and global world we live in, it's a terrific mix.
Now is the time to speak out about the importance of the ACA and Medicaid to you and to your family.
It is critically important for us to come together to have a discussion around healthcare reform because we need to use our collective voice in order to advocate for ourselves and our continued access to healthcare. And it's important for us to use education as a means of empowerment.